Anyway, first I want to thank Marilyn and the organizers for inviting me. This is almost 40 years after the first time I presented, so I'm really pleased to be here and present all the work that I've been doing over the last 40 years or so. So my plan is to introduce you to biofeedback, review its medical and consumer applications, and provide a basic demonstration. I just want to start off with a question. What does India's Olympic gold medal winner have in common with the Italy soccer team and NASA? And I'll answer that later on. So as we go through it, you'll get a feeling for it. So you've all heard of autonomous vehicles, robots, and decision-making AI programs such as Watson. Yet we live in an autonomous world, the best example being nature itself. Consider all the bodily processes you don't have to consciously control. Imagine if you had to direct them all. You could do nothing else. It's only when something goes wrong that you're forced to intervene, usually in the form of medication or dietary changes, and less often in a self-control strategy. It's increasingly clear that the best way to delay or avoid disease is through prevention. Eating a healthy diet, exercising, sleeping well, avoiding risky behaviors, including some spiritual practice, and managing stress. So for the last 40 years, I've immersed myself in the field of biofeedback. And it basically monitors any physiological signal in the body and feeds it back to you in an enhanced form, either through auditory, vibratory, or visual feedback. And the peripheral feedback, which we have, we're monitoring heart rate and skin conductance, other sensors, which I'll talk about, is called the normal biofeedback. And the specialty of that is called neurofeedback, or EEG biofeedback, where we monitor from the scalp. So how does it work? We're always producing signals in the body. But if you have a goal to change something in the body, say it's to decrease your heart rate or decrease your blood pressure or decrease symptoms of ADD or strengthen your bladder so that you can control incontinence, having enhanced information about small changes in the signal is really what's important. So what we do is we monitor those signals, the specific signal that we're interested in, amplify it and present it in a way that the person can get information on it and learn to control it. So it's very important that you know what you're monitoring. You're not going to go from the brain to control the bladder. See, in this case, for example, you've got somebody's giving a motor control command to the muscle. The muscle tenses. We see that it tenses. How much did it tense? We say, oh, when I do that, it tenses this much. If I do this, it'll change. And so this is a simple example of biofeedback. But suppose you are using, for example, you're playing tennis. You hit the ball over here, and if all you can see where the ball is going, you've got feedback. It's going there, and it's going there, and eventually it goes there is where you want it to go. And that's not physiological feedback, but it's just feedback. And that's what you're learning to do with biofeedback in general. So some of the pioneers of biofeedback included Dr. John Basmajian, who taught people to actually control single motor units in the arm. And that actually has led to the field of rehabilitation medicine, where you can use muscle feedback to control muscle activity. Dr. Joe Kamiya, somewhere around late 60s, discovered that subjects could actually control their brainwave activity. And he has actually led to the idea of brain control and eventually to alpha control biofeedback. And Neil Miller taught people to control their blood pressure and heart rate and intestinal motility. This is Elmer Green. In 1970s, he hooked up a fellow named Swami Rama in India to a QEEG. And he discovered that this fellow, when he went into meditation, produced huge amounts of alpha activity. Very popular. People said, oh, meditation equals alpha, and so people started making alpha machines to teach people to meditate. And it's basically a byproduct of meditation. It's something you can use to help you with your meditation. It is not meditation all by itself. But it certainly got people interested in biofeedback and neurofeedback. So I've always been very curious about medicine, and I already had a master's degree in electrical engineering, and I heard about this field of biofeedback in 1974 at the American Psychological Meeting in Montreal. And I saw the devices, which were huge, weird-looking devices, very medically oriented. I thought I can do that, so I built something in a little pill container with a couple of pennies on it. And as you get stressed, the tone went up. As you relax, the tone came down. And then I got friendly with the people at Concordia University, the sculpting department, and ended up making several models. This is one that I started the company with this, and we actually made about 12,000. They're made out of walnut and gold-plated brass. And you just rest your fingers on it, and you hear a tone, and as you relax, the tone goes down. As you tense, the tone goes up. So it was the first really portable biofeedback device. At the same time, I entered the doctoral program at McGill in experimental medicine and had a doc and postdoc grant and worked with GSR to control pain and eventually with angina patients with the cardiology department. Again, just using the GSR, but later, but measures sympathetic nervous system arousal. So why do we use biofeedback? It requires adopting a holistic view of yourself while taking an active role in the healing process. And you do this by encouraging positive behavioral changes. The approach is in sharp contrast to the use of medication, where something is invasive and is done to you rather than you doing it yourself. A recent report into the clinical efficacy of biofeedback concluded, biofeedback is appropriate for those who prefer to take control of their own health or who don't respond well to traditional medical treatment. So this is the most typical sites on the body where you'd measure the signals. Skin conductance is measured from the fingers or the hands or the feet. EEG is from the brain over here. EMG is which is electromyograph, is muscles, is from any muscular area. So you can do it from the legs, the arms, wherever. ECG is your heart, or EKG. Photoplethysmograph looks at peripheral blood flow, and that's a sensor that you put on your finger, and it picks up the pulsations in the finger, and often used for relaxation. Respiration, you put a band around the chest or around the abdomen to teach abdominal breathing. Temperature, cold hands usually indicate stress. You teach people to warm their hands. And then there's all kinds of sensors like force, angle, sound level, etc., where you can use that for feedback as well. So the first device I designed, as I mentioned, was a skin conductance device, or a galvanic skin response. And we put a fixed voltage, about a half a volt, across the fingers. And then we watch how the current goes through your fingers related to how stressed you are. What happens is, as the sympathetic nervous system increases, the pores in your fingers open and the electrolyte concentration increases. And that produces, and in this case, you'll see it on a meter, a tone will change, and you can get it from there or there. But the feedback is from the change in the opening and closing of the pores and the electrolyte concentration. And it's very, very sensitive, which I'll demonstrate to you in a moment. We've got a bunch of the units here. So it's one of the basic signals. It's the signal I prefer the most from all the signals that are out there, including brainwave activity, muscle, and all, because it's almost instantaneous. If I go like that, within 3 seconds I'll get a like that, and that's one of those. Those are responses from some kind of stimulus. And the nice thing about it is that you can train yourself to say, "Oh, that just happened. I'm going to get a little response, but I'm going to come back down quickly right after I've got that." So this is the unit that followed the GSR-1. This is the GSR-2. And we ended up making about a few 100,000 of them. And mostly we sold them through catalogs to psychologists and hospitals, and became it's interesting. I mean, there's so many out there, and I keep getting emails from people and letters saying, I used your unit, or bump into people who use it, because it really does help you get in touch with yourself. This is like a 64-channel EEG monitor, which picks up signals from all over the brain, and we can look for abnormal patterns, and often that's done in looking for head trauma or attention deficit problems. This is done for assessment. Most of the feedback's just done with a 2-channel system. These are the waveforms we're looking at. So delta is, basically it's just deep sleep, and you don't see very much of that in the normal brain when you're awake. Theta is sort of daydreaming imagery, and this often actually happens a lot in children who have ADD or can't pay attention. You'll see these sleep spindles popping up, and alpha is the sort of meditative state that you get into. I was talking about earlier. And SMR is that zone, that focus state when you're doing something, and you can be driving a car or focused on something, you're not even aware of it, but you're just doing it really well. And we train athletes to do that often. And beta is high beta, is sort of anxious, busy thinking. So we can look at all these frequencies by just breaking them down using what's called the fast Fourier transform. There's something called the mind mirror. We actually made a version of that where they've got sort of a Coke bottle. Maxwell Cade was the fellow who invented this in England. And it produces this deep meditative state, which is like a Coke bottle pattern, the high frequencies and low frequencies combined. So usually we're monitoring EEG from one or two sites. In this case, we're looking basically at CZ in the top of the head and using references to the ear. But it is frequently used to teach for ADHD, learning disabilities, PTSD, and migraine headaches. This is a typical training screen, one of the screens we created. And when you're in the zone, whatever that zone is that you define, whether it's suppressing a theta and increasing SMR or whatever, the little leprechaun will start collecting gold coins. And so the child or the adult who's doing the training doesn't really have to know or understand the signal. All he has to do is know that keep the thing moving, keep the leprechaun moving. And it's a trial and error. It's a little bit, it's operant conditioning, like the pigeon that's pecking at all over the cage and suddenly hits a lever and he gets a food pellet. And that's what it is. It's trial and error, and you eventually get to figure out what it is. Sometimes we can give hints. Sometimes it helps to get into a slow, deep respiration pattern, to feel yourself very relaxed, to meditate a little bit, depending on what. Again, if we're looking at SMR, you want to be awake, alert, and not in a sleepy state. Electromyograph sensors monitor activity from any muscle. This is on the frontal muscle, but you can do it from arms and legs. And it's often used for paralysis, for post-stroke rehabilitation, and for muscle re-education. There's loads of applications, as well as for incontinence, to strengthen the muscles.
I have one question.
Yeah, sure.
It's a very abstract. I always knew that you can monitor these brain waves, but actually, what's happening in the brain? How do we produce these waves? Can you just give us a...
Well, we're always producing a multitude of brainwave activity. It's a mixture of everything at all times. If you're very sleepy, if you close your eyes, you'll produce beautiful bursts of alpha all the time. And if you don't, then usually that's an indication you may have a problem. But open eyes with alpha is difficult and also can indicate a problem if you produce too much alpha. But some people have trained themselves to do that. And actually, I'll talk about that after, but I think this is one of the dangers of some of these really cheap EEG headsets. People are doing things where, if I can be successful at training someone to suppress ADHD symptoms, if I give them the opposite feedback, I should be able to enhance it. And some of these things some of these products are actually doing that. They call it focus, etc. But this is not a great place to be monitoring from. It's much better to get it in other locations, but they're harder to get from because there's hair in the way. So respiration, you get it from either the chest or the abdomen, and often you look at the ratio for deep abdominal breathing is what you're generally looking for. And that's really one of the best ways to relax. Okay, so if you wouldn't mind, all of you, each of you just take a really deep breath now and watch what your body does. Okay, so how many of you noticed that your stomach went in when you took a deep breath? That it went in? Put your hand up if your stomach went in. 1, 2. Ideally, your stomach should go out as you breathe in because your diaphragm is dropping. So as you breathe in, and then you breathe out. And so we can train you through using the two bands, but generally just one band on the abdomen is enough to teach you to get deep rhythmic breathing. And it also turns out there's something called respiratory sinus arrhythmia, which is if you breathe at about a resonant frequency, about somewhere around 6 breaths per minute, your heart rate will follow as you breathe in and go down as you breathe out. And someone who's in really good condition will produce a huge change. We worked with Montreal Canadians. We had 45 beats every time you just breathed in and went out. And one of the indications of potential heart disease is very small change, 2 or 3 beats. It means your body, your blood pressure response, the baroreceptors aren't responding well to the increased respiration. So, so that's one of the things to do. We actually have I think I'll get there. I think it's in here. Yeah, this is a little program we made for Windows where you can set it to whatever your so-called resonant frequency is, somewhere around 6 breaths a minute. And the bar will go up and down. And usually it's about 3.5 seconds up and about 6.5 seconds down. So like a breath every 10 seconds. So if you follow me now, let me put you through this. So don't overbreathe. Don't go. Just so like. All right. So let's start. So breathe in now. Breathe in.
With abdominal breathing.
Yeah. Breathe out. Now breathe out. And in. So we've got a program that you put on the finger sensor and the respiration band, and then you breathe. It takes you from 12 breaths or so down to 11 to 10 to 9 to 8, 7, 6, 5, 4. And then you can see in the playback which one got the greatest synchrony between the two. And for some people it's 5.5, some 6.5, 7 or so. It's about the range. Yeah. And so you can just pick the one that actually works the best for you, but it seems to be in that range. So this is a device that I had made for me just recently, about a year ago. And it cycles just the way you saw that, but it's a beautiful blue light. It just goes from off to brighter, and then I don't know if I've got it. No, that's it. And then it comes back off, and you just leave it on a table or in the conference room or next to your computer. And every once in a while you just look over and you go, oh. So I've got them all over the place. And you can get them again at the Biofeedback Foundation. You know, they're $25 or so. So this is what I was talking about when I said picking up heart rate. You can get it from the chest, you can get it from the wrist with EKG, or you can pick up what's called photoplethysmograph, and it's just basically a light reflecting off the capillaries in your fingers and then bouncing back onto a photocell. And it produces a waveform that's a pulse. And that's an EKG waveform, which is actually the sensory, censoring it from the chest or the wrist. It's more accurate, but this actually is quite good. It's good enough for most of the feedback and easier to use. So here's what I was talking about with the RSA. So you can see breathing in, this is the breathing, and this is your heart rate. Clunk, 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 and this is the rate of your heart. So you can see how beautifully it tracks it when you get to that proper rhythm. And actually the goal actually is to train yourself to increase that heart rate. And you can do that through the training, through the breathing and all. And that seems to be physiologically important. So we can look at what's called, look at the interbeat intervals, and we can do what's called, it's an FFT on it, and we can break it down into looking at the peak, and the peak seems to be, the ideal seems to be 0.1. One above is parasympathetic, below is sympathetic nervous system, which is stress, relaxation, but this seems to be the ideal balance. And that actually happens if you breathe at about 6 breaths a minute, that's what you can end up with. So basically, we're just the ideal thing with that is to use it for anxiety, stress, for asthma, hypertension, and pain. It's as you all know, breathing is so critical to everything we do.
Since it's efficient for pain and all the mentioned aspect, I suspect that it would be good for the immune system as well.
Well, I would assume so. I mean, there is
less level of stress, then better response to
sure.
immunity.
Yeah, one of the fellows who was very involved in the biofeedback movement wrote a book called Psychoimmunology, and it was all about that, how to use biofeedback and other techniques to affect the immune system. And he actually monitored a lot of the markers, physiological markers. So temperature biofeedback, as I mentioned, cold, clammy hands, or the coldness is from lack of blood flow to the fingers. And when you get nervous, the blood vessels constrict and blood doesn't go to your fingers. And it's part of that adaptive response, the fight or flight response, which, when you're faced with a challenge or a threat, you your hands get sweaty because you had to grab things to escape like the monkeys do. And your hands get cold and your feet get cold because you want the blood in your core and to your brain. Glucose goes to your brain as well. So the coldness we can measure. And when we're doing stress management, if you put a sensor on the finger, you can actually see a change in the temperature from, it's a nice sort of a smooth gradual change compared to the skin conductance, which shows you the phasic episodic changes. And so you're often aiming to get to about 97 degrees, really quite warm hands. So this is just how it works. Basically, these will compress, will constrict, and you'll get less blood flow to the hands and feet. So, typically a user would watch the display and see that green line. That's the hands warming up. It says 90 degrees, 90, and that's over a period of time, just over about 3 minutes. That's a change in temperature from 70 degrees up to 95 degrees almost. It's quite significant. Yeah, so it's very useful, for things like migraine headaches is one of the things I was doing when I was at the Allen Memorial Institute. We were working with migraine patients, and we were training them to warm their hands, which seemed to have a profound effect on the migraines, on decreasing migraine frequency. And for Raynaud's disease, which is very cold hands, especially with when you're outside or whatever, your hands get actually blue. And you can train people to warm their hands doing that, and for edema as well. And of course for hypertension, because hypertension is basically constricted blood vessels, which is making the heart work much harder to get the blood to the periphery and to all the arteries and capillaries. So this is a list of many of the applications of biofeedback that have been compiled by the American Association of Psychophysiology and Biofeedback.
May I ask, you had edema up there. How does biofeedback work for edema?
I think a lot of it is actually just relaxation training and increasing blood flow to the areas. I mean, so much of edema and psoriasis are often stress related. So it's another one of those techniques. The nice thing about the biofeedback is, you can certainly do a lot of this just with deep meditation, tuning into the body, but it gives you instantaneous feedback. So you know that you're succeeding, which is nice. You know when you try something, oh yeah, that's working. So you get reinforced constantly.
All of these are more physical symptoms, and a lot of them are related to stress.
Yes.
Have you looked at any of the effects of the personality or the psychological or the state of being of a person?
Yes, so there
has cold hands, usually somebody that has a lot of constriction in their muscles.
Yeah, exactly.
Back.
Yeah.
And if you were able to show them to have warm their hands, it's something in their whole energy system is relaxing.
Yeah, sure. I mean, there's when I was when I was doing my doctorate, I was working as a behavior therapist. We used to use autogenic training and progressive muscle relaxation. And they're all basically in that ilk. And when you do relax the muscles, you're obviously allowing yourself to let the blood flow increase. And it's all linked together. There's no question. Yeah, for sure. I mean, we certainly create a lot of our own illness.
Yes, but how does it work? You have to do it every day. Or?
Well, it depends. What are you talking about? Something specific, or? Were you picking one of these specifically off the list here, or just in general?
Yeah, I mean, like it says rheumatoid arthritis, pain, stroke,
Yeah. Well.
How does it work?
Well, I'm going to go into that in detail, but some like for ADHD, it takes about 40 sessions, and you usually come in and work with a therapist once or twice a week. But the brain rewires itself, and it says, I'm not going to produce the theta, I'm going to start producing more of this SMR, I'm going to learn how to suppress. And it's sort of, when you're learning to play an instrument or whatever, your brain actually devotes more area to that, to learning that instrument and playing that instrument. And it's the
How
same.
many times do you have to do it?
Well, it depends on the disorder and how serious it is. So as for ADHD, as I mentioned, it's about 40 sessions, a couple of times a week. For stroke rehab, it can be, there's a fellow, Bernie Brooker from University of Miami, who's worked with people 6 years post-stroke and got them functional again. So your brain is really plastic, and there's a possibility of retraining areas. It doesn't work for everybody, but we've actually, someone has now taken the Bernie Brooker method in Germany and is actively using, we just developed a suite for them so they can keep using it with patients now. Biofeedback often just is an adjunct to other programs, other parts of your therapy. It's not often used just all by itself, unless it may be for stress management and all. But usually it's, involves cognitive restructuring, cognitive therapy, behavioral, and tons of other applications, and medical. All of our products go through FDA. I mean, every single one of them. So we have to prove that they're at least equivalent to devices that were out before, or that are, that meet medical standards. So we get inspected once a year by the FDA, and we go through ISO. And so, but if you get something like a NeuroSky helmet or a Muse or one of these devices that are, out for $99 or a couple $100, you can't be assured of what you're getting, the signal quality, or what you're feeding back. I mean, ideally, you should have a therapist working with you to train you at least initially, and then it's possible to take a device home. Most of the work is done in the clinic. People use our GSR, or what we call MyoTrack for muscle rehabilitation. It's about $500 for the MyoTrack, and that's often useful for muscle re-strengthening, or even well, I'll tell you more about that, the applications after, because I'm going to go through them. You have other questions? Yeah. So this is the ones that seem to be the most successfully used, and so it's stress and PTSD, urinary and fecal incontinence, alcoholism and drug addiction, ADHD, autism, hypertension, rehabilitation. And there's several others, but these seem to be the top ones. Head trauma's in there.
That include Asperger's?
Well, that's all the same. It's that syndrome all the way from ADHD to autism in there. And stress.
Wow.
That's actually a doctored photo. I didn't do it, but...
The machine would blow.
Exactly. Well, I think his machine would blow. Yeah. It's interesting. We worked actually with Hans Selye back in, the father of stress, to define stress, back in 75, 76. He actually endorsed the little GSR. And he said this: every stress leaves an indelible scar, and the organism pays for its survival after a stressful event by becoming a little older. So there's 5 main categories of anxiety disorder. There's general anxiety, generalized anxiety, phobia, panic, acute stress, obsessive compulsive disorders, and PTSD. And they're all treatable to some extent with biofeedback. So how many of you would you say experienced excessive stress in the last few months? 1, 2, 3, 4, 5, 6, 7. Everybody has, well, good percentage of the people, yeah. See, the chance of having a lifetime, the lifetime prevalence of stress is about 9%, and it's higher in women. It's usually a 2-to-1 ratio. And fortunately, there's safe alternatives to using drugs, and this is one of them. So, how many of you know about the performance arousal curve? If you're much too relaxed, it's a inverted U-shaped curve. If you're very, very relaxed, you're not going to get much done. You can hardly get off the bed. If you're overly stressed, you can't think clearly. You're exhausted. Your body's just like this. You can't function. It's that ideal spot at the top of the curve where you need enough stress to function. So you don't want to. And it's interesting. I remember seeing some people who were doing transcendental meditation, and I said something, I went like this to them, and they went, like nothing happened. They just had learned to flatten completely. And it's interesting because that's not the way a car honks its horn, and you get a response. You'll see the GSR go up. The car honks its horn again, and again, and again. You stay up there. But if you learn, the idea really is to learn to respond, to be alive in the world, but also to bring yourself back down again quickly. And that you can learn, and that really can learn. And the problem often with meditation is that people think that's the way it should be all the time. Like that 6 breath minutes, you wouldn't want to breathe like that all day long. You get nothing done. But it's very good to do it a couple of times a day. So we've worked a lot with PTSD, the U.S. and Canadian military. And so what happens is you present the soldiers with some of the traumatic events, either through audible stories or through visual, some videos or whatever, or you just have them recount what happened to them, and you monitor their physiology, and you show them which. Often you'll see one channel responds more than another, so you work closely on that to teach the person to actually bring down that channel. And what it turns out is that if you have someone reliving the experience over and over again, but you can dampen the physiological response, the brain says, oh, that wasn't so bad. And they're actually using Int'l, propranolol, in some studies, which is a beta blocker to keep you from getting that response. And that it seemed to help in some people. But the idea is to decouple the memory with saying, oh, it wasn't quite as bad as that. And it takes training, but at some point it really does. It certainly helps. That's the example of skin conductance training on that. Yeah, this is really interesting. It was a disturbing new study from Argentina that demonstrated that stress can be a significant trigger for the onset of Alzheimer's disease. Early symptoms of Alzheimer's is found in 72% of the patients who experienced severe stress 2 years prior to the onset of symptoms, versus only 26% of the group that did not report excessive stress. So it's certainly a good reason to learn some kind of stress control procedure. That's a big difference. Yeah. So good reason to learn something, some way of relaxing. Yeah, so one of the things I come up with when I was doing therapy was creating what I called self-calibration, which is say to yourself on a 0 to 10 scale, how stressed am I? And when you get above a certain level, like above a 5, you say, okay, what stress technique do I know that can bring me back down again? And so, with the biofeedback with the little GSR, gradually you learn. I mean, when I put my fingers on, I've got a conditioned response now. I hear, and I just relax. And so, if you ask yourself during the day, where am I now? If you get above a 5, you take a break, walk, do whatever it is that's required to get you to come down to a 3 or 4. But if you get up to a 6 and a 7, it gets really hard to relax. And that's when you feel it's once you get too stressed or too aroused, it's really hard to bring your stress level down. That's why I think it's important to constantly ask yourself, if you have to, just get out of there, get out of a room, go take a break, go into the bathroom, do anything to get out of the situation.
Has there been studies to verify how much time or how much effort it has to be, or consciousness that has to be placed? Let's say you say on this scale of 1 to 10, once you pass a trigger zone, let's say, and you're at the 6 or at the 7 or at the 8 or at the 9, how much more time it takes? Is it exponential to bring it back to a normal?
I don't have a specific answer to that. For me, it's always been just a personal thing that people do. You personally rate yourself, but if you know yourself that once you're really stressed, that it really is a lot more difficult once you're up at that 8 or 9 to get your heart rate down, to get yourself calm. It clearly is somewhat. I don't think it's linear. I think there's definitely. I think it's harder. The higher you get, it becomes somewhat exponential. Well, there's Selye talked about eustress and distress, EU stress, and you're really excited about something wonderful, birthday. You're super excited. It's a positive stress, but if you're doing that for all the time, it's still going to be a stress on the organism. For example, someone who runs in a triathlon, you're really pushing the body. And some of these people go for these several day meets where they're running across mountains and everything else. It really burns the body out hard. They're enjoying it, but it's taking its toll.
So physically, stress is stress regardless.
It is, yeah.
Yeah.
But your perception of it and the way you feel about it is changes.
What if you use exercise as a way of
decreasing stress? Yeah, but you're only talking about 30 minutes of exercise, or not whole day or whatever it is. Yeah, you're not pushing the organism past its natural point. Yeah. So one of the theories of developing hypertension is that so you get the car honks its horn. Somebody says something to you. You go into vasoconstriction. Sympathetic arousal goes up. You sit there. up, you sit there, you try to come down, something else hits you. So all day long you're under a situation where you're constricting your blood vessels, and now your heart has to pump harder, your heart enlarges, you end up with hypertension. And then it's that sort of simplistic way of explaining it, but that's one of the dangers of not being able to manage stress and filter stress in some way. I had a client who was afraid of elevators. And so in the lab, I taught her using the GSR to bring the tone down and relax, and as we described, getting on an elevator or walking towards an elevator. Then gradually we put the device in her hand and had her walk towards the elevator. As the tone rose, stop, bring it down. And it took several weeks, but then finally get on the elevator, go up and down without the tone rising. So that's the idea of keeping it, 3 or 4 or 5 before you get up to the 7 or 8. And once you get into that, you get into a sort of a panic attack, and that's really difficult to reverse. Often we do what's called the stress assessment. So we're looking at all those different measures over there on a graph, and you look at the ones that change the most. And you say, okay, we should work on this. You have a tendency to tense your forehead too much. You stop breathing. I noticed when I was training with Pavlov, Ray Pavlov, the grandson of Pavlov, was in Montreal. I had a company called Alter ABC, and we got friends. He says, Hal, you have to train. So every Wednesday I went there for almost a year, and we trained on this, and it was really interesting because first he started off with just EEG. He had somebody else's equipment, so then I gave him one of ours, and we monitored skin conductance, temperature, EMG, respiration, heart rate, and the brainwave activity. And so I was trying to start off with alpha, where I'm training to go into a deep meditative, relaxed state. And so we do that. I usually fell asleep. He said, okay, sleep for 20 minutes. He could see sleep spindles. And then I'd come out of that and train for another 10, 15 minutes. And then we do SMR training, which is that focus state training. And I was doing okay. And then we looked at my temperature was going down. My skin conductance was going up. I was breathing at 14 breaths a minute. You could see all that. So then I put the breathing on the bottom and started breathing at about 6 breaths a minute. And I was succeeding about at the same rate, but it wasn't that stressful. So even though you're teaching people to get into that zone, the SMR state, which is ideal for ADHD, but they can be burning themselves up in another way unless you look at the peripherals. So I think it's important that you mix things like that. This is actually, his friend is at my country place right now. He just wrote a book called The Path, and it's really, really excellent. It's 40 years of work with Gestalt therapy and cognitive restructuring, and it's a practical book on how to get back on your path and to develop resiliency. It's on Amazon now, and my girlfriend's reading it and loves it. Right, she's going through it step by step. So there's about 15 million North Americans who have incontinence, and there are 3 different types: urge incontinence, stress incontinence, and mixed. The stress is when you cough, laugh, or sneeze, and you have to learn to tense the muscles. Otherwise, especially after childbirth, you'll pee in your pants. And there's also, there's also fecal incontinence, which often happens when there's been some damage or as you age. And so we can actually monitor the muscle activity either through a vaginal rectal sensor or through muscle sensors on either side of the anus and pick up the activity. So what we're doing is we're just training people to strengthen the muscles, just like Kegels, when you do Kegel exercises, it's strengthening the muscles. But the important thing is to relax the abdominals. Because you think about the bladder as a balloon, if you tense the abdominals muscles at the same time, it's like squeezing the balloon and squeezing the exit of the air. So you want to learn to tighten this, but to relax the muscles around the diaphragm. So you use a combination of 2 sensors to do that until you know what you're doing, and then you can use a home trainer with just 1 sensor. So it takes about 11 sessions or so on average. And this is an example of a session where you tense and you try to get above the threshold level, and then drop and wait 5 seconds and do it again, and wait 5 seconds and do it again. So, and you'll get, it says work, then rest, work, then rest. And it's really, really effective. It's amazing how quick it can be. I had a friend's mother was 92 years old, and she said, can you lend me one of these devices? And within 2 weeks, she was continent. She had just learned to, one of the tricks is learning which muscles to tense when you're going to laugh or cough or sneeze or whatever, and it really helps. It's also really useful for pre and post prostate surgery and pre and post childbirth, obviously. But these studies show that males will regain they'll become less incontinent, let's say, after they've had prostate surgery, if they've practiced before and after. And so home training can be really effective. And these are some of the devices we make. This is your, I don't know if you can see it there. That's the rectal sensor. This is a vaginal sensor. And the therapist never touches. The person just goes in the bathroom, inserts it, and comes back out. And then you plug it into the device. That's that one over there. It's called U-Control, and it's a home trainer. And it tells you to tense and relax, and you can keep setting the threshold higher and higher until you learn to, until you're strengthening the muscle. The middle one is a computerized one, and this is a device that it's a handheld unit which has its own graph on it. Now we know that alcohol and drug abuse in Canada and worldwide is a huge problem, and approximately 4% of Canadians are alcoholics. And so are drug problems are also very serious, and it has a huge impact on accidents, rape, truancy, suicide, etc. It costs about $40 billion a year, the cost of alcoholism. And it has a big effect on family stress as well. Well, neurofeedback and biofeedback has been used for years to help addicts control abnormal brainwave activity. And the most popular technique to teach control over alcoholism and drug abuse is to actually teach people to get into the alpha state. And what people often who are attracted to drugs and alcohol often are trying to avoid emotional states. They get into real emotional states. And so they don't want to go into that alpha state where actually emotions come out, so they spend a lot of time in busy other states or using drugs and alcohol to avoid it, to avoid the painful feelings. And so by training them in alpha, bringing down into the alpha area, it really is, you really need a therapist to work with you because it opens up the floodgates and out comes a lot of emotions. But it really does help. It's often, now they're starting to use some drugs like MDMA and low dose of LSD and something to break that fixed pattern you have. And this is a legal and quite effective way of doing it. So ADHD it's the most common childhood psychological problem. It is diagnosed in approximately 5% of the population, the North American population. And 70% of those people get stimulant medication. And paradoxically, they're using stimulant medication for kids who have ADHD. And I just don't get it. The cost of using biofeedback is about $4,000 a year. It's about 40 sessions, and it's about the same price as the stimulant medication. Generally, they're looking to see if there's too much slow wave activity in the frontal area of the brain. And it's a ratio often of the SMR and the alpha. So if the ratio of the higher frequency to the lower frequency is really low, that often indicates, it's a relatively good indication of ADHD. Yeah, it's interesting. I mean, kids can play like stressful games. Kids with ADD, and they're really good at it because it's hunt peck constantly. But when you give them something like do math problems, yeah, it does, and that's part of the thing, I guess, with the stimulant medications in a similar way. Oh yeah, if it's stimulating enough, it's easy for them to focus. Like violent games, they're really good at it. The other thing, of course, is that people are really concerned about the long-term effects of some of this medication. They're seeing coronary problems and other problems with it. And if you can avoid it, if you can do it naturally, it seems a lot more reasonable. Yeah, one of the things I always thought was that kids who have ADHD may have a sleep disorder, and so they're compensating to try to stay awake. And then you'd look at food allergies and look at everything else that's related to all that. So how many of you know people, someone who has ADD? You obviously do. And is on medication? Most of them, eh? Mm-hmm. There's people in Montreal who are doing, I don't know where you're from, but there's all over the US and Canada and actually all over the world working with biofeedback or neurofeedback. It's definitely worth trying. I mean, just a few sessions to see how it goes. You know we can affect our genes in our own lifetime, and so if the parent was, you can actually pass that on. Oh, so this is a training screen that we'd use with a child who's got ADHD or an adult. And the green is the SMR, the sensory motor rhythm activity, the higher frequencies. And so you'd say, make the sailboat move ahead and keep those two behind. That's your theta activity, the slow wave activity. And this is that high beta activity, the ruminating muscle activity that you want to suppress. And those it represents, the bars on the left show how we're setting it up for these screens. So this would be, this is the theta. We want to keep it below a certain level here, so it is now. And the SMR, the green should be above that. And this is the high beta, and it should be below that one. And when all those conditions are met, you'll get the green boat moving, and the other ones will not move. And then you accumulate points, and so it's rewarding. That's one of about several hundred screens we have like that.
Watching 12-year-old Alex ride his bike, you'd never know he struggles with ADD.
I knew that I had a problem, and I knew that I wanted to fix it.
Outside of school, Alex was tired all the time. In school, he couldn't concentrate.
I just couldn't get my thoughts out because I was always staring off into space.
What we're trying to do with Alex is speed up the front part of his brain. Typically with attention deficit disorder, we have too much slow wave activity in the front of the brain.
With the help of a listening tool and graphics, Alex can see and hear his brain waves and learns how to increase his own brain activity.
That's exactly what we want to have happen there.
Several sessions later, Alex is able to concentrate again.
So the brain will then learn, oh yes, when I'm reading or I'm doing homework, I'm supposed to speed up because he's getting the auditory response.
Over time, Alex won't need the high-pitched sounds to tell him he's on the right track. He's already noticed a difference.
From getting ready for school in the morning to doing my homework I can't name a thing to say that this training hasn't helped me in.
Alex has found his focus and a new friend.
Wow.
Yeah, we get tons of that. I mean, it really is very effective. We're talking about the autistic spectrum disorder, which goes all the way from ADHD through Asperger's to autism, and there's been some reasonably good results, and it's basically a similar kind of feedback, working with suppressing that slow theta activity. But it requires it's much more severe and requires more than just biofeedback for sure. But it was found to increase language skills and emotional and social skills as well as attention. So about 60% of North American adults have hypertension or pre-hypertension, and the people at highest risk are African Americans, the elderly, the low-income people, and people who are overweight. Often temperatures are probably the most important. Again, because you're looking at slow changes, decrease in sympathetic arousal, increasing blood flow. And so you use temperature feedback, and it often helps from the hand to the foot. The muscle rehabilitation is really an important area. It's useful for chronic pain, for migraine, tension, headaches, for bruxism, and for paralyzed, to readapt paralyzed muscles following injury or stroke. I'll give you an example. Our little MyoTrack, the small handheld unit, can be set so it doesn't give you any kind of feedback unless you go above a certain level for 4 seconds. And if you have jaw pain, for example, you can put it on the jaw, and if you clench, nothing happens. Then finally, so you can move around, you can chew, you can do what you want to, but if you hold it during the day or during the night, it'll set off an alarm. So it teaches you to be conscious of the fact that you're clenching your jaw. Or I did it for, actually I just put a trackball on the end of my chair to try to relax my hands. I'm mousing around. And I monitored my shoulder activity. And every time I was using the mouse, I'd raise my shoulder until I finally found a way of putting a holder over here for my hand, my arm, and for my wrist, and then the tension was down. So you can use it for something like that and to remind you of your stress level. Yeah, the idea is it's like meditation. You want to learn a relaxation skill. And this will help you do that. The temperature will give you sort of objective measure of the fact that you're succeeding. We actually had Tibetan monks working with our GSRs, and they were using it as a competition, believe it or not, to see who could relax the fastest. But a lot of the work with transcendental meditation was done using skin conductance. Benson's work back in the 70s. So here's an example. We're trying to teach someone to tense the forearm and relax the extensor. So the flexor and the extensor. And so the white would be the flexor, the red is the extensor. You notice how when I tense one, the other one relaxes. The red goes down as the white goes up. And so the idea is to train. You don't want, when you want to do a movement, you don't want to tense everything because it'll move like this. So you want to learn to just do that or just to do that. Well, I mean, you're looking at muscle activity, which is a very small signal. It's down to the 1/10 of a millionth of a volt, up to about 1,000 microvolts. And so when you're looking at very, very relaxed muscles, it's a hard signal to measure. But for example, someone after a stroke, you'll see absolutely no movement on the arm. So you put the sensor on there and you tell them to tense it and nothing. But on the screen, you'll see little tiny blips and you'll hear a tone go, and then gradually you'll see a little bit more, and then finally you'll see a little bit of movement to give the feedback. And once you've got that, now you can actually get the feedback visually, and you don't necessarily need the screen as much. But when you've got no activity, the signals are it's so sensitive to the signals, you can use that to enhance it and help you. Often, we also have a device, the MyoTrack Infinity, which, if we want someone who has a stroke to learn what a strong muscle feels like, we'll have them just get above that threshold, and then we'll give them an electrical signal, stimulation, and you go like that, and then relax, and then you set the threshold a little bit higher. And so at the same time, you're strengthening the muscle and giving the brain feedback that if I do this, I'm going to get a muscle contraction. And it's a very good combination. Ramachandran did a really interesting study where he had someone who was he couldn't move his right arm. But, he couldn't move his left arm, so he put a mirror over here. And he had the patient try to move his left arm, but the patient's looking at the mirror and he sees the right arm doing this. And gradually the left arm started doing it, saying, oh, it's okay, I guess I can do this. So the brain, you can fool the brain into doing that. And they did it also for phantom limb pain, where he felt like his hand was clenched like that, and he just relaxed this hand, and the brain said, oh, I'm relaxing this hand. The stimulation helps model it, as does just the biofeedback, because you can see something is making it work again, and so you just keep enhancing that to make it work. So one of the nice things to do is take, once you've got it, you can take one of the little devices home with you and train at home, because the more you practice, the faster and you'll improve. This is actually a Chinese. Our Chinese market is our second biggest market after the U.S. This hospital has 168 of our devices here, MyoTrack Infinity. Huge hospital. And they're using it. You can see this is to teach for shoulder stabilization, for the problems with the shoulder and popping out of the socket and all that. So it's amazing what they're doing in China with it. But it's wonderful because they realize that it's so important that you can teach people to do this on their own rather than trying to use surgery or other techniques. And you all remember Alan Alda from MASH? He did a little program. That's one of our sensors on his head, using it to show how you use it for bruxism control. This is an interesting application. A woman by the name of Stephanie Blaine Moras hooked locked-in syndrome patients, children, to our equipment and had them monitor their heart rate, their skin conductance, and temperature, I believe. And she tied it to music, which she called biomusic. And so when someone would approach the child, you'd hear like a really unique pattern. And it made a big difference to the caretakers suddenly realized there was somebody there. And it also was unique. You could tell if you were doing something positive or negative to the child in terms of the responses you were getting. This is a calligraphy therapy. We're using fine motor control. One of our Japanese distributor came up with this idea to teach biofeedback to do calligraphy. And couples therapy is really interesting, is another application. You're monitoring their physiology, each of them, as they talk to each other. And one of the techniques we came up with, which is interesting, you put headphones on them. And so when they're talking to each other, they can hear it, but as soon as one of them goes over threshold, they both hear a white noise, like shh. So they can't talk, so they can't continue and talk to each other.
They don't need the mother-in-law anymore.
Right. So there's many different applications. I'm going to quickly go through this because I'm running out of time. We've worked a lot with sports teams over the years. That's Alex Bilodeau, who won gold, and he trained to increase, to go from alpha to SMR really quickly. So when he was flipping in the areas in the alpha state, when he hit the slopes, he'd go back to SMR. And he and Jen Heil won gold by training that, but he did it over and over for months. He trained that way. India's gold medal, the first gold medal winner, trained with our FlexComp system and won gold for target shooting. AC Milan set up what's called the Mind Room, and over a period of several years, they had 11 of these stations set up with all the players, and a psychologist would show them videos of activity, of field play, and give them feedback on their stress responses and get them to be able to get into the zone over and over again as they practice that. This was an article done about that, about AC Milan in the Gazette a while ago. We also worked with the Vancouver Canucks, the Canadian Olympic speed skating team, freestyle skiers, and a ton of other athletes all over the world. And even Ferrari, we've been working with both the mechanics and the drivers, teaching them reaction time to be able to improve reaction time, changing tires and all, as well as keeping their stress levels under control. And we worked with NASA for years, so they trained underwater, 165 feet underwater with our equipment to learn to control their physiology and to overcome the stress of working in isolation from the workload. And this was an interesting guy named Steve Mann did this thing, a brain music deconcert, where he measured people's brainwave activity and produced music with it. And McGill actually bought 64 of our systems for musicians and the audience to be monitored at the same time to see how they interact with each other physiologically. Then I monitored David Blaine, the illusionist, in Times Square as he controlled his physiology while he was so-called frozen in a block of ice for 3 days. And do you guys recognize this fella? Spock. Yeah, he actually endorsed our product. It was called a company called Human Engineered Software used our product with the first IBM PC in 1986. But the cool thing about this product was we had a car racing game we called Compris, and the more stressed you got, the slower the car would go. So the only way you could perform was to keep your stress under control, and then the car would speed up and it'd start hitting the wall, and you'd get stressed and it would slow down again. But gradually you could get through there quickly. So it's teaching you performance under stress. This is a refinement for the like the sailboats. It's the same kind of idea. You got to keep the green car ahead if you're in the ideal zone. And virtual reality is being used a lot. And I'm sure you're reading a ton of it now, but for years we've been using it with biofeedback. And we've got situations where you get an airplane, you hear the engines start up, you look out the window, you see a magazine in front of you, and we monitor your physiology and give you feedback on screen or through tones when you're getting really stressed. And if it gets too extreme, we'll stop the simulation. And again, for desensitization, it works really well. So this is what the biofeedback equipment looked like in 1973. You can see they're all, huge devices and all, and that's when I came up with my little GSR-1 and GSR-2. And then we introduced all these different programs, weight control, sleep, public speaking, flying relaxed, et cetera, which are all written by psychologists. Actually, one of them, this one was Dr. Sideroff back in 1980, who wrote that book. And they're really good because they were audio tapes, now they're MP3s, along with a workbook that helps you work through the problems that that you have with either weight or pain or whatever it is. And those are actually still in production. And these are our most current devices. So this is the ProComp and FlexComp and ProComp 5, and there's a MyoTrack and GSR. These cover the whole area. Like these devices, you can plug in any of the sensors into any of them, and then they hook into a computer. And then we've got all these are all our sensors, and I won't go into all that, but we've got a ton of that. And the biofeedback software, that's another screen DDA created over there. And the only way, and that's the one actually Alex Bilodeau trained on, was get that damn mouse to move. Only when he got in the right state would the mouse start walking across the screen like that. This is a cute one that the instruments that only play when you got your SMR up, the alpha, the theta was down, and the muscle activity is down. Then the whole orchestra will play music. So you have to, you want to listen to the whole orchestra. You have to be in the right state.
What SMR stands for?
Sensory motor rhythm.
Oh.
Yeah. And this is an example. You can use any DVD and play that as well. And this is the latest thing. We've got a stress suite that we just brought out that teaches you stress control using either temperature and skin conductance or heart rate. And then we've got products for research. I'm just going to go through this quickly. And then there's this whole area of wearable technology. I was mentioning before, this is impinging on our area because most of this is not FDA approved, but they're monitoring. There's now about 250 heart rate devices out there, and the Apple Watch has got a heart rate sensor in it now. And the idea is to make some sense out of this. And the problem is a lot of these devices average your heart rate, so you really can't get what's called heart rate variability out of them, or they're movement sensitive. And then, as I mentioned, the EEG headsets are generally not accurate enough for clinical feedback. But a lot of clinicians are buying them because they're cheap, which is really unfortunate. All these training, the cognitive training programs that you can do on your iPhone or whatever. Adding physiology to it makes a huge difference. So you can actually not only just enhance your brain through the exercises, but also look at how your physiology is changing and train that as well. That's some of the examples of the consumer devices out there, and there's our medical one below it. And this is a new product we're just about to bring out. It's called the eView TPS, and it picks up skin conductance, temperature, and heart rate from one finger. And it works with Android devices and uses true heart rate variability to train you.
Binaural beats.
Oh yeah, we actually have that built into our software. If you're producing your dominant frequency, let's say between 8 and 12 hertz, and you're at 9 hertz, and as you age, your dominant frequency drops in the alpha range, it seems. So what we do is we produce a binaural beat of 9.5. And so what it is you put in a frequency, let's say, of 1,000 hertz in one ear and 1,009 hertz in the other, and your brain just hears like wah, 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 like if you've got a propeller where one's going faster than the other. And the idea is to entrain the brain and pull it towards the frequency that you're interested in. Yes, we do have that in there. Yeah, so this thing also has an accelerometer in it, so it helps. Actually, that's one way of avoiding movement artifact when you're looking at heart rate, is to measure the angle. But because of that, I can also measure respiration. You put it on your stomach. So medical grade quality, and these are some of the apps that work with it. We've actually developed a lot of algorithms for stress response to look at what does it mean when you get a change in heart rate, skin conductance, temperature. How do you interpret that? What does this mean to you, and practically, and how can you use that to help you with with your day-to-day life? We have a few minutes, and Dide is going to quickly demonstrate, and one of you could be a guinea pig if you want to get hooked up. So we're going to ask you a really embarrassing question right now. You ready?
Okay.
Okay. Let's see what we can ask you. Look at the trace on the screen. And see, she laughed and went up again. You notice that? That's your skin conductance, the same as a GSR device that you have. And so it's much easier to go up, and it takes much longer to come back down again. So you're asking about how do you what kind of feedback are you getting? Well, that's the idea. You say, okay, now if I relax, how am I going to get that tone down? So I ask you, just look me in the eyes for a second, okay? Look at the tray. It's just making eye contact will give you that kind of a physiological response. And you're not usually aware of it. It's just, that happens on a moment-to-moment basis. And that's why I like skin conductance or GSR so much, because it's so responsive. Or if I sang and asked you a really embarrassing question, you set that up. I've never asked the question, but I always get the response. Again, so if I'm going to ask you a really embarrassing question, even though you know I'm not going to ask you that question, look at the response. And laughing does it, obviously. So.
Thank you very much.
Thanks a lot. My pleasure.